Hello everyone, I'm Rachel Lowe from Physiopedia and today I am talking to Christian Barton. Hi Christian.
Hi, Rachel.
Thanks for joining us today. We're super delighted to talk to you about the knee today. Uh, Before we do, I was wondering if you might be able to just tell everyone who's watching a little bit about yourself, who you are, the work that you do and why we should talk to you about the knee.
Yep, sure. So I'm what we consider a clinical academic. I often consider myself more just as a geeky clinician more than a researcher, although I do spend a lot of time doing research. So I spend probably about half my time seeing patients, seeing around about 30 patients a week, and probably half of those patients relate to having chronic knee pain, and quite a lot of them are running injuries, not always knee, but various other conditions as well. And my research areas, I work at La Trobe Sport and Exercise Medicine Research Centre, which is a new research centre set up in Melbourne, and I've got the pleasure of working with Professor Kay Crosley, Professor Jill Cook, Professor Peter Bruckner, Hilton Manns, and various other great postdocs as well. So lots of good people to gain insight from. And my main passions around research relate to the knee, so particularly this course, a little bit of running and tendon, but also particularly around research translation and going into the space of trying to improve online learning for patients and for clinicians. So this course is kind of perfect for where my passions lie.
So, and in relation to your interest in the online learning space, and in particular knee knowledge, you'll be joining us for this course throughout the 4 weeks, hopefully, as we run this for people as a group to take part in. And we're delighted that you're going to be able to join us in the discussion forums a little bit, and then hopefully at the end we'll be able to do a live question and answer session with you to answer everyone's questions that haven't necessarily been answered through the course. So we're absolutely delighted to have you join us for the next few weeks. Thank you so much for that. But maybe we could talk a little bit about the knee before we delve into the course. It would be really good to hear some of your insights into the knee. I know when people start these courses, obviously they have things that they know themselves that they want to get out of the course, what knowledge gaps, they might have some knowledge gaps of their own that they know about. But what would you say would be something for people to think about as they work through this course? What is the knowledge that people need to have, or is pertinent knowledge to have, to be able to effectively treat an individual with a knee complaint?
Yeah, I think probably the number one thing, and this is for any musculoskeletal issue, but particularly knee, I think not every knee is going to be the same. So it's understanding that you've got to really individualize your treatments. What I like about the knee and what drew me to it from a research perspective is I kind of see the knee as the meat in the sandwich when we look at lower limb biomechanics. So yes, we've got knee pathology or we've got knee pain, but actually a lot of times what's driving that knee pain doesn't actually have a lot to do with what's going on around the knee in most cases. It's got a lot to do with how your hips functioning, possibly a lot to do with how your pelvis is functioning, what lot to do with how your foot and ankle is functioning, and those factors play a really big role. So I think one of the key things about the course is, I guess, is understanding, well, what's the evidence base around different exercise interventions that might help us to manage different knee complaints. But importantly, we might have a randomized controlled trial that says hip exercise is effective in knee, but you know what? Some people, there's probably not much relevance to doing those hip exercises because we know that life's not a clinical trial and we know that's not an RCT, and we've got to think about bell curves and things like that. We might be something where we've got to target the foot and we've got maybe less evidence around exercise for the foot. So it's probably just getting a really good understanding around that. There's also probably a number of other interventions, different manual therapy techniques and things like that, taping, foot orthoses, and all of these things can play a part in our management of some of knee pain. Ultimately, our key treatments come down to exercise and also activity modification education, but all these other little adjuncts can often play a really big role. There may not be strong evidence. I think it's keeping an open mind to what might work for your individual patient, I think is really, really important. And hopefully in the discussion forums we can have lots of chats about that. And one of the fascinating things I find about physiotherapy knowledge around managing knee pain is it's not always as strong as it could be. Some of the preliminary research that we've done around foot orthoses, for example, we have probably a quarter of physios that I survey believe that foot orthoses are not an evidence-based intervention for something like patellofemoral pain, when actually we have really good evidence that in the short term that you probably need to give them to between 2 and 4 people, and at least one of those people will get significantly better. And these are inexpensive prefabricated ones. And if you use a few simple clinical tests, then you can actually probably target that, and almost every time you give it to someone, they'll be effective. So hopefully we can tease through some of that as the course goes on. I think the other exciting thing about the course, you guys have some great presenters teaching as well. So I'm actually looking forward to learning from some of them also and getting some of their clinical insights.
Yeah, we have. We're talking to some great people over the next few weeks, and so we'll be delighted to share their knowledge as well. So, listening to what you're saying, so to be able to and analyze all those issues that might be going on at the hip and the ankle and the foot and ankle as well that are affecting the knee, assessment's going to be an important part of being able to effectively manage an individual. How can people become effective in their assessments?
Yeah, I think having a really good understanding of your clinical biomechanics, so the way in which your hip should be functioning or could be functioning well, same as the foot and ankle. If you do have a dysfunction of that, whether that be muscle endurance, muscle strength, muscle patterns, maybe range of motion and flexibility, how that might impact on the knee. And then I think from there you can have a really good understanding about what treatments might impact on managing a knee. So if you've got a muscle that's perhaps weak or got poor muscle endurance around your hip, then very clearly if you're walking or running, then that muscle is impaired. It's not going to take the same shock and load as a good muscle in terms of endurance, and ultimately that's going to put more load on the knee. So sometimes it's as simple as that, but it's identifying tests that we can use as part of that, and that's not always clear in research trials and some of the stuff we use in clinical practice. We need to be a little bit more innovative. For example, if you look at research trials, well, how do we measure hip muscle function? Then a lot of people will use maybe handheld dynamometers and just look at maximal isometric strength. Now that's a test of a muscle in a really specific action, and the reason people use that in research is it's a really reliable test. Does it relate much to what happens in clinical practice? Maybe not a huge amount. It might give us some insight, and certainly we see in almost all knee conditions that people have weakness as a result of or with that test. But actually we need to think more cleverly about how we assess hip muscle function, and maybe look at things like muscle endurance and thinking about how many single leg bridges can a person do, or maybe we can test repeated resisted contractions, or maybe we need to think about using things in the gym like 10 repetition maximums and those types of things. So it's probably thinking a little bit about some of our strength conditioning literature and bringing all that in. So it's not as simple, I think, when we think about applying evidence-based practice as just getting a clinical trial. And for some reason, us as physios, we seem to have that perception a lot of times, and I think we need to move past that, because I think it was a really well pointed out thing at the IFOM conference, which is where I first met you, is that actually the whole world is full of N=1. And it's really hard to do a clinical trial on N=1. So we need to use evidence to guide what we do in practice. I think that's really important. And hopefully we can bring a lot of that out, not just in the learning on the course, but I think the discussion forums. And sometimes people don't always like to participate in those things. And we know that from some of the research we've done with Physiopedia. But actually that's one of a really good way of learning. And hopefully as part of this, we'll make that really fun for people to engage and to learn a lot from.
Yeah, great. So, I mean, a lot of the course does cover... we can't cover everything on this course, so a lot of it does cover the basics of knowledge that we need to have to be able to effectively manage individuals. So the discussion forums will be a really good place to sort of extend what we've been talking about through the week, and some of the basic or core reading that we've offered, the core activities that we've offered. So the discussion forums really are the place to extend on that knowledge and to extract all that knowledge from you as well. From someone who actually, who works in that area, who has a lot of experience in that area. So we're looking forward to those discussion forums and encourage people to be active in those through this course. So I guess we need to get on with the course. We can talk to you again, Christian, through the course, and hopefully we'll have a live question and answer session with you towards the end. Do you have any other messages that you'd like to give to the participants who are taking part as they start on this e-course?
Yeah, I think I guess one of the other things is online learning is a fantastic medium in that you can come in and out of it as you're able to with time and things like that. So I think just fitting it in where you can as part of your work and things like that. But I think also as part of that, one of the things that often lacks with online learning, which we can easily compensate for, is you don't often get a chance to practice things and do the practical side, which is often really important for consolidation and learning. So I think hopefully you've got a colleague who's maybe doing the course alongside you, and maybe some of the theory that you learn, see if you can put it into practice, even just doing clinical tests and talking to each other about it and how you might assess it, and and practicing with each other. And if you don't have someone doing the course, well, one of the best ways to learn is to teach someone else. So why not grab another colleague, it might be a more junior or even a more senior colleague, and teach them some of the stuff you're learning and go through that with them as part of the course. And I think that'll really consolidate what you learn, so doing some practical aspects with it as well. And that's probably, I think, a really key bit of advice I can give people doing some online learning.
It's a really good point. We're never going to be able to teach practical skills. Well, at the moment, we're not going to be able to teach practical skills online. And we do encourage people to practice in their own contexts where they're working at home with their colleagues, with their peers. So it's a very good point. Thank you for mentioning that. So I think, unless you've got anything else to say, I think we can leave it at that for today, and we'll look forward to talking to you again later in the course.
Yeah, no worries. Look forward to meeting everyone along the way.
Thanks, Christian.